Hi ADN students, I hope that you've had a good week. I know you guys have had an insanely busy week, so I just wanted to remind everyone that there is exam 2 that is coming up on Monday. Remember that you have basically the whole day to take it, but once it's open, you'll only have those 60 minutes to do the exam. So after looking at quizzes this week, I don't know if it's because you guys don't really know where to study, or if you guys just had other things going on and PEDS was kind of on the back burner. Unfortunately, I see this even in the face-to-face. PEDS is one of those courses that people kind of leave to the last minute. And it's just that, guys, we're going through so much content in such a short amount of time that you really do have to kind of stay with me as best as you can. If we were in the face-to-face, I would be doing basically a body system an hour is how I would do this. So it does move very quickly. And you have to remember, I mean, I'm covering an entire book in 8 weeks. So I do kind of have to cram things in there. So for the exam, I'm going to throw you guys a bone. I'm going to give you guys a breakdown of the things that you need to focus on when you're studying this weekend. So grab a piece of paper, pen, pencil, and start writing, okay? Um, as I told you guys in my weekly check-in video, I'm planning on 15 questions from the GI chapter alone. This is a big chapter. In terms of pediatrics, if I had to put, what I think are the most important chapters in pediatrics, GI would be in the top 3. So I want to make sure that we cover GI and that I make sure that I prepare you as best as I can for your NCLEX. So I'm going to ask you a question on GI assessment. I'm going to ask a question on transesophageal fistulas slash esophageal atresias. Those are kind of treated the same. I'm going to ask you 2 questions on celiac disease. You'll have a question on Crohn's, a question on intussusception, one on obesity, one for pyloric stenosis, one question for cleft lip palate repair, a question on appendicitis, a question on functional constipation, one on Hirschsprung's disease, one on gastrixis, one on biliary atresia, and one on gallstones. Okay, so that hopefully will help narrow down where you're going to study this weekend. Keep in mind, guys, you know me, you know how I test. I get that it's been a while since you've been through my exams, but you know I like assessments. You guys know I like interventions, both medical and nursing. You know I like evaluation questions, and I really like education, okay? Do you know how to educate? So guys, really spend some time on that nursing process when you're going through these things. For your renal disorders, I'm going to ask you 2 questions on urinalysis slash urine culture. I'm going to ask you nephrotic syndrome, urinary tract infection, VUR, which is the vesicoureteral reflux, nephrolithiasis. I have 2 questions on glomerulonephritis. I have a question on hemolytic uremic syndrome. I have 2 questions for acute kidney injury and one on hypospadias. And that'll wrap up the renal disorders. For the big chapter, the hematologic, immune, and neoplastics, I have 3 questions on iron deficiency anemia, 1 question on sickle cell anemia, and 1 question on hemophilia. For immune, I have 1 question on HIV/AIDS, and it's going to be a select all that apply. And for the neoplastic disorders, okay, look over absolute neutrophil count, or an ANC. And like I told you guys, I'm going to do a lot of communication with this stuff. So, chemotherapy and pain management, okay? Questions on leukemia. I've got one question specifically on leukemia. Chemotherapy interventions. Look over bone marrow aspiration. Chemotherapy teaching. What do you want to teach the patient? What do you want to teach the family? Uh, Overall cancer teaching in general, I have two questions. I have one specific question on Wilms tumor, communication with the parents on cancer, and that'll wrap up that chapter. Like I said, typically with the cancers, I'm not going to get into nitty gritty details. It's more about education. The parents ask you this, what is important to educate them on. And then the final chapter is your end of life. I have two questions on end of life communication. I have a question on pain management at end of life. I have a question on family presence during a code, which, if you guys know me, I'm a huge advocate for. And then I've also got a question on a DNR order. Okay, I can't promise I'm going to do this again for the other exams, but as I've told you guys in the past, this exam, because it's the first one of the body systems, students kind of panic a little bit over. So if you guys have any questions, email me. Like I said, Monday the exam will be open. You'll have that full day to take it. You'll have 60 minutes, and then I'm probably not going to get these graded until Wednesday. Okay. I hope you guys have a great weekend studying. Stay safe.